New York Times, Tuesday, May 31st, 2011. 30 years in, we are still learning from AIDS. The article talks about where it starts 30 years ago at the onset of AIDS, and it's talking about how when the illness first came to light in America, it says reports in the spring and early summer of 1981, young gay men in New York and California were ill with forms of pneumonia and cancer. So far, the article says 30 billion people have died. It says that would infect more than 60 million people worldwide, killing at least half that number. So 30 billion people have been killed so far by AIDS since they started keeping records in 1981, or since they first found out about AIDS in 1981, in America at least. It also says here that they didn't know a lot about AIDS, and when it first appeared in the New York Times, it was called Rare Cancer Seen in 41 Homosexuals, and they commented how they didn't have the word gay in the Times style manual. It also goes on to say that experts argued about many theories about the cause. Of course, as some of us know, it first started out being called GRID. I'm jumping ahead of myself in an article here, but they said it takes 3 years to conclusively, or it took 3 years to conclusively identify HIV, the virus that, of course, is known as AIDS. So it also says they realized that people had been unwillingly transmitting the virus for years, of course, because AIDS takes a while to, or sometimes it can take a while to register in people. It's laying dormant for decades. It also talks about how, especially when it was first rising, people were uneasy with treating each other. Many doctors, uncertain whether AIDS was an infectious disease, refused to do essential procedures on their patients because people didn't know how it was transferred. It also said they put out a new type of patient for doctors. It says in the AIDS epidemic, many medical students and doctors in their 20s and 30s suddenly had to cope with dying patients their own age. It's talking about the symptoms. It says that here the federal health officials and experts came up with a succession of names, and here it talks about early efforts smacked of discrimination, like GRID, for gay-related immune deficiency, referring back to its homosexual origins, AIDS, in America. It says here that there's a lot of stigma with AIDS when it first came out. People not want to go to certain restaurants because of homosexual waiters. It talks of Ryan White, a teenager with AIDS in Indiana, who stood up as an advocate, a national hero before his death in 1990 to children with AIDS. But one thing I thought is interesting is that this story just talks about AIDS effect in America, and starting with homosexuals and things like that, but it really forgets Africa. It doesn't talk about Africa at all. Africa is invisible here. It just talks about what AIDS was like for the Americans.